presented to you today is entitled Chakras Energy Deficiencies as a Cause of Dyspnea Post-Coronavirus Infection Treatment. In this presentation, I will describe two case reports of patients who had coronavirus infection and after the treatment began to complain dyspnea without doing any exercise. In this presentation, I will address some causes of dyspnea in Western medicine, and after I will explain what could be the cause of dyspnea in the energy point of view. Patients with coronavirus infection disease, COVID-19, often have clinical characteristics such as chest tightness and dyspnea. And continuous unresolved dyspnea often indicates the progression of lung lesions. And the mechanism that underlies the chest distress and dyspnea in patients with COVID-19 is still unclear. However, our clinical observations show that although some patients had significant chest distress and dyspnea, the lesions that were observed in the lungs during computed tomography were milder or not completely consistent with clinical symptoms. And we found that the extensive inflammation of the bilateral and respiratory bronchioles in patients with COVID-19 due to excessive activation of pro-inflammatory cytokines and chemotatic aggregation of T lymphocytes at the site of the inflammation are possible mechanisms underlying chest distress and dyspnea in patients with COVID-19, according to Western medicine. And the primary target organs of SARS-CoV-2 in the human body is the lung. The primary presentation of patients including respiratory tract symptoms such as cough, fever, and dyspnea. Although 50% of patients with severe case of COVID-19 over the age of 60 years, lung or cardiovascular disease develop dyspnea 1 week after the onset of the disease, which can progress rapidly to acute respiratory distress syndrome, difficult to contact metabolic acidosis, coagulopathy, and even death. I would now like to talk about the study based on all my studies, which was based on all my publications and presentations. And this case happened in 2007 and changed my way of constructing and applying treatment. This patient in question was diagnosed with, had the diagnosis of leg pain and was using anti-inflammatory medications without any improvement. And he searched another type of treatment in using TCM tools, traditional Chinese medicine tools. And his first diagnosis in Chinese medicine was kidney yang deficiency. The patient was taking anti-inflammatory drugs without any improvement. And for his treatment, I prescribed the Chinese dietary counseling, auricular acupuncture, and systemic acupuncture associated with apex bloodletting to treat the symptoms according to his energy imbalances. And associated, this is a figure of the apex bloodletting and the auricular acupuncture sessions I did to him. And the patient presented an improvement of his leg pain after 10 acupuncture sessions and went back to my clinic to be reevaluated again 30 days after. On this occasion, he revealed to me that he also had a major improvement in his symptom I was not aware he had. He was being treated for glaucoma in the last 40 years with no significant improvement. And for this first time, his intraocular pressure diminished from 40 mmHg to 17 mmHg. This was the first time that his intraocular pressure reduced in 40 years of treatment. And the treatment of kidney yang deficiency not only improved his symptom of leg pain, but also improved his intraocular pressure. And this case became a cornerstone of all my studies so that I could treat all symptoms of all cases and in all patients, treating the root of the problems that are the energy imbalances and not just the symptoms. And for this reason, I have been to several congresses all over the world since 2007 to show the way I have reason to treat the diverse of pathologies, and which lead me to be a researcher at the University of São Paulo in Brazil, in patients with glaucoma by treating the patient's energy imbalances and not just the symptoms. And the theme has already been published in the entitled article, The Treatment of Asthma Based on Traditional Chinese Medicine and Homeopathy, where the mechanism is also explained according to Chinese medicine. Each shortness of breath is due to the deficiency of kidney energy. As I had great success in the treatment of patients with pain in the legs and glaucoma, I decided to present this case at the American Association of Medical Acupuncture Congress in Baltimore, United States in 2007. And from this study, I developed several other studies in the most varied specialties, all involving the root treatment of the problem, which are the energy imbalances, are not only the symptoms. This case was also presented at the Society of Acupuncture Research Congress, which took place in Harvard University, United States, entitled Acupuncture Viewed Holistically Can Treat All the Patient's Disease Simultaneously. Now I'd like to present a two-case report of a patient I treated myself. The first case was a patient, 42-year-old woman. On September 4th, 2020, she began to feel changes in her body, but nothing significantly. On the night while participating in an online lecture, she dozed off, and when she woke up, she felt very tired, which made her fall asleep again quickly. The next day, since waking up, she felt a general malaise and her whole body was sore, especially in the hip and her leg muscles. During the night, the pain intensified, not allowing her to sleep. 2 days after, on September 6th, the patient realized that beside the pain she was having, she was feeling lack of taste and smell. And the other day, in addition to all these symptoms, she started to have a runny nose and sneezing, which lead her to go on medical duty and have the PCR exams. And doctor prescribed fluimucil for 7 days and Ebastel 10 milligrams initially for 5 days, but it was finished in 5 days. And the pains remained for about 7 to 8 days, and the runny nose quickly subsided. Around the 6th or 7th day, she reported back pain on the right side, which led her to take the medication ivermectin. And she remained in isolation for 14 days, and during this period, her symptoms decreased, and she did not experience shortness of breath. And after 17 days, the patient had medical clearance to return to work. And from the first day she went back to work, she began to feel tired through the afternoon, becoming breathless when she spoke. On the second day, when she returned home, she had shortness of breath that generated a panic attack because she was unable to breathe and had to work hard to recover from despair and to be able to breathe again. And the difficulty in breathing followed her all week, always in the afternoon, since she works with communication and needs to move between different sectors all day. She was already my patient before this crisis because she was treating her hypertension, hypothyroidism, bruxism, and tinnitus using traditional Chinese medicine tools, using Chinese dietary counseling, acupuncture, and her diagnosis in TCM was kidney iron deficiency, blood deficiency, and iron deficiency. And about 2 months before contracting the COVID-19 virus, I had measured the energy of all her chakras through the radiesthesia procedure, and every chakra were in the lowest level of energy, rated from 1 to 8. All her chakras were in 8. With the exception of the 7th chakra that was in the normal rate. So I prescribed for the patient the treatment for replenishment of the chakra's energy with homeopathy medications and crystal-based medication. For the first chakra that corresponds to the liver, I use phosphorus. The 2nd chakra corresponds to the kidney. I use natrium muriaticum. The 3rd chakra, the heart, I use sulfur. The 4th chakra corresponds to the lung. I use silicia. And the 5th chakra is spleen. I use calcareous carbonica. These organs corresponds to the 5 massive organs in traditional Chinese medicine. And all these organs have an energy function to maintain the health of the body. And one organ has an external sensorial organ that they command. For example, the liver is responsible for the eye and for the vision function. The kidney is responsible for the hearing process and corresponds to the ear. The heart corresponds to the tongue and is responsible for the communication and the communication process. And the lung is responsible for the nose and the sense of smell that I told you. She had anosmia because of the lung. These chakra were without any energy. And the spleen has the mouth as the external sensory organ, and it is responsible for the sense of taste. And that is why in majority of patients that I had a study, I will present in a few minutes, that between 2015 to 2020, measuring about 1,000 patients, the chakras energy of 1,000 patients, I discovered that more than 90% of my patients during this period had no energy in any chakra. This meaning that they were, energy means immunity in traditional Chinese medicine. That is why the majority of the patients that I was treating in my clinic during these 5 years prior to the coronavirus infection, they had lack of immunity due to the lack of energy in the chakras. And on Friday, after she came back to work, when she consulted with me and reported such problems, I prescribed a single doses of that medications in a sequence that I will show you. And this presentation, this publication about this medication is published in this journal, and the title is Constitutional Homeopathy of 5 Elements Based on Traditional Chinese Medicine, where I'm using traditional Chinese reasoning to treat this lack of energy on the chakra, but using highly diluted medication that I will explain to you why I'm using high diluted medication instead of high concentrated medications. And you can search for this publication to see how I construct all my reasoning. And after she take this medication, one bottle of medication per day, in a sequence that I will show you, and do the Chinese dietary counseling. She improves very quickly the dyspnea symptoms, because she was treating her energy, but due to the infection, she consumes the energy quickly. And that's why after the treatment, I need to replenish the chakras energy with more potence of the homeopathy medications to replenish the chakras energy, improve her symptoms. And I did the recommendation to avoid the dairy products, raw food, cold water, and sweets, because this food can imbalance the spleen and pancreas energy that is responsible for the absorption of nutrients to produce more blood in her body. And if you maintain this consumption of dairy products and all these kinds of food, all the foods that she's consuming is not absorbing adequately and not transforming energy to be distributed in all her internal organs. I also recommended her to avoid the coffee, soda, and matcha tea, because these kinds of foods can harm even more the kidney energy that she had already low. And this kidney energy I will show you is the main energy that is involving in dyspnea symptoms in coronavirus infection patient that I will explain you later. And here is the foods that I tell her to avoid chocolate, fried food, coconut, alcoholic beverages, and melted cheese, eggs, and honey too, because this food can lead to the liver and gallbladder meridian imbalance, leading to the formation of internal heat that are the energy imbalances leading to the inflammatory process in all kinds of disease, and in this case, in the coronavirus infection. And here is to show you that I am taking out the heat retention that she had through the exterior bloodletting, and I use the auricular acupuncture to balance the internal energy again, using points to balance the kidney, spleen, the liver, heart, lung, and to treat her emotional symptoms, using anxiety points to treat her emotion too. And until she felt better very quickly after the treatment. But she didn't recover yet her sense of taste and smell, but she recovered from the shortness of breath, and that had already subsided completely with this kind of treatment. And the second case report is a 56-year-old woman. On May 2020, she had a COVID-19 diagnosed by laboratory serology. She contracted at her workplace at the shoe factory in my city. And her initial symptoms were pain in the whole body and runny nose. And she searched for infectious disease specialists that prescribed azithromycin and chloroquine hydroxide. And she didn't have shortness of breath symptoms in the beginning of her infection, but after approximately 1 month after this treatment, she started with shortness of breath, even without doing any physical effort. In her past history, she started 4 years ago with a burning taste in her mouth. So whenever she ate, her stomach would swell and over the time her lung got more and more swollen and compressed, which gave her pain, swelling, and shortness of breath 4 years ago. And the patient states she's been struggling from doctor to doctor for 4 years to see if she can find out what it is and take the correct medications to improve her symptoms. And the patient has already looked for specialists in the area in other cities, all types of exams and nothing to get a positive return. And the patient states she is in constant pain, swelling, had shortness of breath in this period of 4 years ago. In last year, in October 2019, she had shortness of breath. Was not bad that the doctor thought it was from her heart, and the patient even did a cardiac catheterization exam, but it was normal. And the patient first sought treatment with me, not due to her breathlessness, but due to the swelling in the epigastric part. And her diagnosis, according to traditional Chinese medicine, were kidney yang deficiency, blood deficiency, spleen yang deficiency. And I took a measurement of all her chakras through the radiesthesia procedure, and all were rated 1 out of 8, with the exception of the spiritual chakra, the same as in the first case report. And this lack of energy could reveal the cause of her digestive problem, because the digestive problem is responsible, this 50th chakra is responsible for the digestive problems. And all the doctors, she said, didn't have a diagnosis of her problem, because this problem is in the energy point of view, and you cannot see by the naked eye. But if you measure the chakra, this battery of this energy is completely empty. The patient diagnosis, according to traditional Chinese medicine, were deficiency of yang. You can see that the normal energy that we need to achieve in all treatments is to balance the yin and yang energy according to TCM. And her diagnosis were yang deficiency. And in this case, she usually feel cold feet and cold hands. And in this kind of patient, it's very common to have excessive fluid, abnormal retention of fluid in the body due to lack of normal function in the kidney function. And here is in this graph, you can see that we need to achieve this yin yang qi and blood harmony. And if there is any imbalance in this flux of energy, you can have the formation of heat retention. That is, in the energy point of view, characterized by different symptoms in the human body, such as infectious process. Anxiety is due to the formation of heat retention in Western medicine reasoning, but has this energy imbalance in the energy point of view. And you can have in panic syndrome, in diabetes, hypertension, cancer, and all kinds of disease. You can have these energy imbalances leading to clinical presentations. And these the X-ray and the tomography, lung tomography of the patient that was already normal. And regarding the Chinese nutrition therapy for the treatment of dyspnea post-coronavirus infection, diet is very important. Traditional Chinese medicine understands food on the energy level as previously stated in my presentation. Hippocrates states, make your food your medicine your food. This sentence emphasizes the importance to correct the diet to maintain the health of the body and to cure disease. As there are foods causing energy imbalances, there are also diets that can balance and restore the health of the body. As you can see in this tree-like figure of this slide, this tree is a metaphor I've been using for a while to explain the difference and the interaction between traditional Chinese medicine and Western medicine reasoning. This tree has a trunk with several branches, and each branch represents one medical specialty. And each leaf coming out from each branch, it represents the symptoms and disease of each specialty. And the leaves and the branches are the visible parts of the object of study and practice in the Western medical profession, because the curriculum offered in medical schools around the world. In my presentation today, I'm focusing on the root level, not visible by the naked eye. And in TCM reasoning, when treating the root, we can treat all the symptoms and disease at the same time and using the same method. And in traditional Chinese medicine, we consider the external pathogenic factor that are the cold, wind, dryness, humidity, and heat that could imbalance the energy of this patient. And this tree in this metaphor represents the human body. And the roots of the tree represent the 5-element theory and yin and yang theory. Traditional Chinese medicine sees the individual as a whole, considering this influence of the internal and external pathogenic factor. Internally are the emotions, and externally are these external pathogenic factors such as cold, wind, heat, dryness, and humidity. The patient is of the second patient. She can have abdominal distension were due to deficiency of lack of that is deficiency of energy in the spleen. That was diagnosed in the radiesthesia procedure, responsible for the normal functioning of the stomach, spleen, pancreas, thyroid, and breasts. As the patient had no energy on their chakras, food was not digested properly as there was no energy in the necessary chakra. And the patient had complaints of breathlessness in traditional Chinese medicine. Shortness of breath is sometimes not a symptom of a lung problem in TCM, but can be a manifestation of a lack of energy in other organs. As I show you, this patient had no energy in any chakra, meaning that all the 5 massive organs in traditional Chinese medicine were in the lowest level of energy. All her internal organs don't have energy. It can be caused by the lack of energy by the internal organs. In their case, in her case, it was caused by the lack of energy in the kidney. I will show you in the next presentation why this occurs. That corresponds to the second chakra that cannot receive adequately the energy that sent by the lung meridian that is lack of, don't have energy to. According to the generation cycle, I will show you. Where is the generation cycle? When the kidney doesn't have energy, the energy sent by the lung to the kidney is blocked, leading to the shortness of breath symptoms. And in the case of the patient, she had these symptoms in the past and returned at the coronavirus infection treatment. I will explain why this treatment worsens her symptoms instead of improving. And the patient of the second case in one of the acupuncture sessions reported that she was experiencing more shortness of breath at that day. She had this situation, kidney deficiency. Asking what she had eaten, she replied that she ate a tangerine and these and uh, and these two fruits. And according to Chinese nutritional therapy, these two fruits has cold energy, and when she ate these two fruits, she worsened her yin yang energy disharmony, leading to more formation of the dyspnea symptom in her case. And I advise her to eat all the fruits boiled or grilled to take out the cold energy of these kinds of food, to don't have this energy disharmony. And after this orientation, she was feeling better. This team has already been published in the study entitled "The Treatment of Asthma Based on Traditional Chinese Medicine and Homeopathy," where the mechanism is also explained according to Chinese medicine, in which the shortness of breath in asthma patient is due to deficiency of kidney energy. And according to the patient's report, the patient of the second case worsened her symptoms, and the first and second case, they worsened her symptoms of shortness of breath after the treatment using highly diluted medication. Because here I'm showing the Arndt-Schultz law. This law originates formulated in 1888 by two Chilean researchers. And in this law, they are demonstrating that when you use high concentrated medication, in this case, when you increase the dose of the medication, you reduce the vital energy of the patient. And that is why when the patient are using high concentrated medication to treat coronavirus infection, they can reduce even more the vital energy that is already low in these two case reports. And in the majority of patients that I'm treating in Brazil in my clinic, in this study, that I don't know if I put this slide to show you, the majority of the patient doesn't have energy in all their chakras. And if they acquire coronavirus infection, and if they submitted to the treatment with high concentrated medication, they can reducing even more the vital energy, leading to some symptoms, and in this case, the dyspnea symptoms after the treatment of the COVID-19 using high concentrated medication. And that is why I need to use high diluted medication to replenish the internal energy, the internal organs energy, and using that theory that I show you. And that is why all the patients improve it from this symptom, and improve it from other symptoms such as malaise and fatigue, etc., and depression symptoms. Oh, here's the table that I'm showing you that I did my research during 5 years from 2015 to 2020, and I measured 1,000 patient chakras energy, and I separated in this study from 3 groups: the children and the adolescents, the young adults, and the older patients. And I discovered that all patients doesn't have energy during this period of study. The first chakra is the liver, the second is the kidney, the third is the heart, the fourth is the lung, and the fifth is the spleen. And here is the memory and concentration, that all patients had lack of energy too. And this is another study that I'm showing that this could be the cause of the lack of memory and concentration in all the populations. And here I'm showing that they had not they have common symptoms at the anxiety, depression, anxiety, headaches, anxiety, and knee pain. And here are the most energy imbalances found in this kind of patient, yin and yang deficiency, in deficiency, and in deficiency, and the third group. You can see that the oldest patient, they have internal heat diagnosis in traditional Chinese medicine. This means that this group is more prompt to have inflammatory process prior to the coronavirus infection treatment, prior to the coronavirus infection. And when they have coronavirus infection, this internal heat could increase even more depending on the type of the treatment that you are giving to this patient, and having more complications. And here is some publication that I am showing you. Here is about the diabetic patient. In my research, I am demonstrated that diabetic patient also have lack of energy in all these chakras, and the treatment of all the chakras of this kind of patient is reducing the diabetes and the hyperglycemia in this patient. And here is another study showing the hypertension patients have also the lack of energy in the chakras meridian. And this study was published in this journal. And that's why they all have in common the lack of the chakra, energy in this chakra. Also in cancer patient is another publication I did, demonstrating that cancer patients have a lack of energy in all their chakras too, and the replenish of this energy could lead to even a cure of this kind of patient using this kind of treatment. And here is another study that I'm showing that the patient with myocardial infarction also have lack of energy in the chakras too. And all these patients that's considered the highly propensity to coronavirus infection to have a complication, all they have in common is the lack of energy in the chakras. And that's why I'm showing the necessity of treating this kind of lack of energy to don't have so much complications when they have the coronavirus infection. After the treatment of coronavirus infection patient, it's very important to treat this lack of energy in the chakras energy meridian, to treat the cause of lack of immunity that leads the patient to be sick, and also treat the reduction in the energy level caused by the use of medication in high concentrations that is recommended for some doctors in the treatment of this kind of infections. And the conclusion of this study is that it is important to study and treat the chakras energy when the patient has dyspnea symptoms, especially in the case of patients who had a history of coronavirus infection and had the treatment with this highly concentrated medication. And what treated with this kind of medication, as I show you, according to Arnschutz law. And the treatment replenish the chakras energy using highly diluted medication is very important to recover all the patient's symptoms, in this case, the dyspnea and the abdominal distension showed by the case report 1 and 2. And here is Hippocrates' quote: everything in excess is opposite to nature. If you have, thank you for your attention. If you have any question, please, I will be happy to answer you. Thank you.